here. Wanted to just go over some things. I was born and raised in chiropractic. I've been adjusted since I was 2. So I often just forget what it's like to be new in chiropractic. And we're well known for neck and low back pain. A lot of people don't know we do other things like TMJ and extremities, knees, hips, all that kind of stuff. But I have this lovely spine here. And most people, they tough it out. They decide, maybe not, or they're just very kind of in the middle. Or, of course, there's people that hate chiropractic. There's people that love it. And then there's just all these people in the middle. To be honest with you, I've been all 3 of those people. I have been ecstatic when I've been to an amazing office that helped me a lot. I've been very disappointed in anti-chiro where I went to an office and felt like my problem wasn't taken care of. And I've been in the middle quite often. So there's something about the office you go to that creates the type of patient you are based on your experience there. And chiropractic is one of the best things I know for neck and low back pain, which is why we got that reputation. Regardless of the typical office and the technique and what was going on there, sometimes it's just trial and error. I mean, we all have been to restaurants. We all have been pretty much to clothing stores. These are basics in life, and we know that we don't like every store we walk into. There's certain stores you like more than others, and it's no pleasing everyone. We just are who we are, and eventually the patients end up in the right office that have a good experience. In the meantime, I really just wanted to clarify and go back to some basics here. You have a spine. I mean, there isn't a human without a spine, which means everyone needs chiropractic. Everyone takes care of a lawn when they have a lawn. Even if you don't want to take care of your lawn, you end up taking care of your lawn. There's just too much associated with neglect. The consequences are insane. We're living in a culture where we think old age and arthritis is normal. That just breaks my heart, okay? Arthro means joint. Itis means inflammation of. And we just think that it's inevitable. But this thing right here, the chair, it is not our friend. We're like little kids and our spine is all cartilage and we sat in it for an entire decade, okay? Most people know the process of making Jell-O. It just takes a few hours for protein to solidify into the shape that it was sitting in. What do you think we are? We're a big wet bag of protein, okay? But we've got these lovely bones in here. And this is real bone tissue, okay? This is a spine that's been handed down from chiropractor to chiropractor. And there are actually ridges and bony growths in here that aren't normal, right? We start out smooth and rounded and flexible, and we end up with these tight muscles, and over time they pull and yank, and our body responds to that pressure. You don't just rub a tight muscle and it has no consequence. You tear the muscle if it gets bad enough, but before it did that, it was pulling the whole time, and it ends up taking the bone with it. So most people understand the concept of brushing their teeth. I mean, really, we wouldn't have a lot of neck and low back pain if we were taking care of them and if we had the supportive structures around. 80% of Americans have low back pain, 80% don't have a six-pack. This is totally a direct correlation. People get this. We don't have core strength, we suffer. Now, if you're well adjusted and it's fun to exercise, the probabilities of you keeping that strength up go way up. It puts you in a whole nother category on a bell curve. So neck and low back pain is pretty much avoidable. It comes from sitting. It comes from every day, every movement, a total sum of all your habits. And this is a bell curve. This is what science likes to put humans on, okay? This is the average, this is bad, this is the best. So if you're getting chiropractic in your joints in the world of arthritis and neck and low back, you already put yourself in the better category. If you've never had chiropractic before, you're going to be in this category. And then I hear excuses from patients that come in like, it's in my history, it's in my family history. Okay, okay, well, cancer's in my family history. There's a lot of women at 40 that don't act 20 in my family. I've spent the last 20 years running, eating good, managing health food stores, becoming a health facilitator in so many ways, chiropractor, DiMartini facilitator, on and on, functional medicine, nutrition. So by eating the right things, moving the right way, keeping a proper alignment, just like you would with your car, you give it oil, you rotate the tires, you put new tires on. All those things are just vastly important. And keeping my strength up, it's a total successful winning combination. The question is, why are people not doing it? Well, either they don't trust their doctors, they don't understand why it works, or somebody told them information that's incorrect, like old age, you're just going to have it. That is totally bogus. They don't know that. That is an outrageous claim. If you hit yourself with a hammer every day, I could say you're going to have a bruise in the next 20 years on your head because you keep hitting your head with a hammer, but if you stop, it won't be there. So I just really wanted to take the time to go back to basics, get simple, explain a little bit about medicine and multiple professions all coming together to have an approach on this neck and low back pain. Show you what happens. This is an older female that obviously didn't get enough alignments and how rigid and extra bone growth there is. Obviously, we could talk another couple hours on that. It's just really important to start getting the basics. And those of you that are patients, get a lot of coaching. There's a lot of imaging. There's a lot of videos. There's a lot of educational material in my office, because getting healthy really is your mind connecting with your body and what you've been up to, and making small corrections, which last decades, is probably one of the most powerful things you can do. So thanks for listening. It was really fun to just kind of go back to the basics and review again a little bit about neck and low back pain, and hopefully we just put you in the upper part of the bell curve so that you can enjoy all these decades of life you have, because it's really our ultimate goal. Most doctors I've coached, met, talked to, they just really want to help. They want to help people. We're watching you walk around crooked all day. It's so unnecessary. And there's not a connection between the person and what's going to happen. It's kind of like, I got a teenager right now, 15-year-old boy, and I keep teaching him, what you do now sets you up for what happens the next 20, 30, 40 years in your life, and what you don't do. So it's not just what you're doing, it's what are you not doing. And we definitely are high advocate of keeping your alignments. A little checkup here and there goes a long way. 4 adjustments a year in a lifetime doesn't even add up to one surgery. And surgery is a big deal and doesn't guarantee the health of any other joint. So if you can get your whole body in better shape for less than one surgery, because it's pretty much guaranteed you're going to have at least one serious injury in your lifetime, then to me it's a no-brainer, and just saves people a lot of time and energy, and allows you to have every day more comfortable, less pain, can hang out with your kids, you can work extra. Your sports performance, forget about it. We're working with athletes all the time. Particularly because we have a rehab center in the office, but it's a beautiful thing. It really is a beautiful thing. It's so much fun. We absolutely love it. So if you have questions, please reach out. CaraChiro.com is our website. I made it interactive. Those of you that are patients get a special password, and you get to go in there and do all sorts of other things. Those of you that might be patients someday, check it out. Hopefully we're helping you too, just with information.